Well, welcome back. You know, it can affect your life in a huge way, from being depressed, anxious, giving up hope. Joining me now is Dr. Shyla Murgain with UW Health with how to deal with chronic pain. You know, this is, as I was telling you, is very important to me as someone who struggles with chronic pain. And you have 4 different strategies to really deal with that head on.
And why this is important, Kristen, is that over 100 million people in the U.S. have chronic pain.
Such incredible.
Costing $635 billion annually, it's estimated. So to put that into context, more people have chronic pain than heart disease, diabetes, and cancer combined.
That's an amazing statistic.
It is. So when a pain problem starts, we want to seek medical treatment early, because after 3 months, neural pathways start to change, and that pain condition, it's much more likely for it to become chronic after 3 months. So see your physician early on in the first month or 2. And there are 3 things to keep in mind during that appointment with your physician. 1, do I need surgery? 2, is there a systemic disease like cancer or inflammatory arthritis that I need to rule out? And are there complicating psychological or social factors that may be amplifying or prolonging my pain? So that's really important to keep in mind.
Shyla, I wanted to ask you, and I know a lot of doctors have told me this as well, is keep surgery as a last resort. You agree with that then?
Definitely. And if it is chronic pain, there are things that we can do to better manage it, to keep surgery as a last resort. So one of those things is to be prudent with medication use. Medication's really helpful, but medication just treats symptoms. It doesn't change any of those underlying pain processes. And on average, medication helps between 30 to 50% of pain reduction. So we want to use other things beyond medication to manage our pain, and when we're using meds, to know how to use them effectively and to also know the limitations of medication.
It's amazing how often you hear so many times today about people becoming addicted to painkillers, and you're right, it is such an important topic. So moving on, what is another strategy you recommend besides you know, going to the doctor early and then limiting your medication?
To keep moving, our body needs to move to be healthy, and sometimes with pain we've become afraid of movement for fear of more pain. So know what kind of exercise we need, and also the exercise that won't hurt us. So physical therapy, especially early on, is very helpful to learn some strengthening exercises. Also following the guidelines of the American Sports Medicine guidelines of exercising 20 to 30 minutes, 4 to 5 times a week. What's good cardiovascularly is often what's good for our body and good for pain. And
let's quickly get to that 4th one real quick, Shyla.
Yeah, so develop a toolbox of coping strategies. Pain is a complex problem that requires day-to-day management. We run groups at UW developing these coping strategies. So things like pacing, stress management, relaxation skills, managing our mind, what we say about our pain really can make or break coping with our pain, because we know that we're much more than the pain condition. We want a holistic approach, and what we say about our pain and what we do with it is really what matters most.
Thanks so much for joining us today, Shyla. Again, if you want to find out more information with dealing with chronic pain, just head to our web channel, NBC15.com, click on news links. We'll be right back.